At the same time, the behavior of the person post-accident might reflect malingering or a conscious effort to exaggerate symptoms for financial gain. And so it is not only important to assess the presenting symptoms, it's important to address their truth value according to psychological tests that can help detect symptom exaggeration. And these are called, for example, symptom validity tests, or there might be embedded tests in traditional scales such as the MMPI-2 and its newer rendition, the MMPI-2-RF. And those help in determining causality in the case at hand. Well, there are a few more factors that we consider in psychological injury and law, and as you can see, it's getting up to be pretty complex. But one area that I'm also interested in are the models. For example, the biopsychosocial model helps explain the pain, the stress, and the propagation of the symptoms of mild traumatic brain injury beyond the initial state in which it should have healed when it doesn't. We need to understand all the biological, the psychological, the social, the cultural, and related factors in the whole range of variables that can influence the psychological injuries and the ones that you are assessing. And you should be aware that because this is in a forensic context, the best model is not just the biopsychosocial, but there should be a legal or a forensic component related to the detection of malingering or gross exaggerations that bring symptoms beyond the nexus of causal factors that you have assessed. And therefore, the best way of describing the model is biopsychosocial and forensic. And when we do both together in this field, we have a pretty good model, and we can be more confident that we're meeting the scientific demands in the area, and that our testimony in court will be comprehensive and cover the basics needed to meet standards of Daubert and the criteria of good science versus poor or junk science. There's another factor to consider. Not all of your patients will be of the same social group or social class, etc. And it is up to you to be aware of the literature on the multicultural variations from one group or one sex or one age to the next, whatever it might be, so that in terms of this underlying science and in terms of how they might respond in the various psychological tests that you administer to your patients or the complainants, so that you can get an understanding of them in their individual or group difference relative to the typical norms that might apply to the test or your understanding of these kind of patients in general. So these are all of the areas that I'm going to be exploring today. And what is the most recent research? Let's move to the next slide. Okay, now we're on the slide called Law and Psychological Psychiatric Injury. And so this is the beginning of exploration of all those major areas in psychological injury and law in terms of the recent literature. And keep in mind that I could not review all the recent literature in one article, nor could I review prior literature before in the last few years that might give a better understanding of this area. It's a select literature review, but one that is up to date and will help you understand all the major findings in the area that make sense, and all of the outstanding controversies still out there in our area. And believe me, in our area there are a lot of controversies. And that starts with the adversarial divide. And to repeat, the adversarial divide concerns whether we're working for plaintiff or defense, and the degree to which the attorneys in these two areas put pressure on the psychologist or other mental health professional or any professional working on the case, the physician, for example, to bias opinion and to be partial rather than impartial in offering testimony to court, in writing reports, etc. And we all have to be very aware of that. So our testimony ends up going to court. Now, what Daubert specifies is that the judges function as gatekeepers. They're not scientists, but they should be up to date sufficiently on the science to determine whether, if there are admissibility challenges to the evidence presented to court, whether the challenges make sense, that the evidence should be removed from the case because it is poor science or junk science rather than good science. And Daubert also specifies the criteria involved, at least for court purposes, in defining what is good science. An article by Faust and colleagues in 2010 is relevant to our understanding of law in psychological and psychiatric injury because it points out the difficulty in translating legal concepts into psychological or scientific concepts, and of course vice versa. Psychological concepts might not necessarily be translatable into legal terms, might not be useful to the courts, and might be confusing to the courts. And of course, the classic example refers to the use of reliability in law and in behavioral science. Now, as you know, the reliability in law refers to the concept of validity in psychology and behavioral science, which is confusing because reliability refers to consistency of the data for us, and validity refers to the soundness and the truth value of the data and or the idea or the concept. And to mix up reliability and validity in the terms that lawyers use and attorneys use and the courts use can be very confusing to us if we're not aware of these types of distinctions. The next slide examines the 4 Daubert factors, and they refer to the testability of the evidence presented to court, the error rate, whether it has been peer-reviewed, and general acceptance. The law prior to Daubert in 1993, put out by the American Supreme Court, that related to evidence presented to court is called Fry, and that came out in 1923, and that concerned general acceptance only. So Daubert has added a more precise understanding of what is needed to meet acceptable scientific standards for court purposes. There are other areas in law and psychology and psychiatry that we should know. For example, Shachtman and Sullivan in 2010 examined all the tort reform taking place, and there are many states where there are caps being put on for the maximum that can be awarded for so-called pain and suffering. And this is affecting the area for plaintiff and defense attorneys and claimants as well. And so I'm not concentrating on all the articles that came out, I repeat that. This is a sampling of the articles that give a good understanding of the most recent developments in psychological and psychiatric injury and law. We can have a whole webinar, for example, on what the 4 criteria mean in Daubert and the decisions that came after it that related to it, which, for example, are called the Daubert trilogy. And there are more cases that amplify those 4 criteria, but that is beyond the scope of what we're doing today. Continuing now on to the second topic of forensics and psychological psychiatric injury in law. The first article that I've excerpted from the Psychological Injury in Law journal publication that came out is by Ackerman. In fact, that's a book, and he provides a very useful description of the area of forensics in psychological and psychiatric injury. He refers to the fact there are codes and guidelines in the field that practitioners in the area should be aware of. Even if they're not mandated by your state or provincial association, they might be important for your testimony in court, so you should be aware of them. And of course, it refers to the American Psychological Association ethical principles and codes of conduct. But for example, it also refers to the specialty guidelines for forensic psychology and put out by the Committee on the Revision of the Specialty Guidelines for Forensic Psychology. And Randy Otto is a key figure in the development of these guidelines, and they're in process. Another article in the Ackerman chapter that is useful is one by Andrew Kane, who happens to be the associate psychological editor of the journal. And he reviewed an article I wrote in 2007. And in there I had mentioned in my literature review on the topic of malingering that the estimates of its rate varies from anywhere from 2 to 64%, and indicates that depending on the perspective and depending how it's defined, the rates vary so much that we need much more research on the topic, and I don't think there's a definitive answer to one rate that applies to this area of psychological injury in law. Dr. Kane goes on to mention the two major tests that are very useful in the area, and they refer to the MMPI-2 and the SIRS. Other ones that he'd mentioned include the PAI and the TOM. And all of these can be used to detect exaggeration of symptoms, give an idea about malingering and related response biases. And they should be used, I would say, like in every assessment where possible, in one way or another, to examine these questions. However, can we arrive at a judgment that the person is engaging in malingering based on one result of one test? We have to be very careful. Unless we have incontrovertible proof that there is malingering going on, it is best to approach it in a very circumspect manner and perhaps use a language that is more conservative when addressing the truth value of the claims of the complainant. In terms of other possible tests, authors have indicated that the MCMI-3 is not appropriate for use in the psychological and psychiatric injury context. There's a really great approach by Heilbrunn, Griso, and Goldstein that we all should know of. This book examines the foundational principles that should guide forensic mental health assessment. And they emphasize that we need to adopt a scientific approach. And the science should be of high quality, both in the conduct of the evaluation and in arriving at the conclusions of the evaluation. And we need an expert knowledge of the science in the field and the science used behind our conclusions to be able to defend our testimony in court.